Okay, well, again, thank you everybody for joining us today. My name is Mark Barkley. I am the Director of Member Services here at 3RNet. And today we are going to be covering, this is actually the first ever employer monthly training that we've done here at 3RNet, and I'll explain a little bit more about that as we go. But we're going to spend about the next half an hour, 45 minutes today, kind of walking through 3RNet from the view of an employer who's posting jobs and interacting with 3RNet candidate referrals, and making sure to answer your questions kind of as we go along the way as well. So a couple things before we get started here today. Everybody's lines are muted. So we have quite a few people here with us today. So if you have any questions or comments as we go through this over the next period of time, feel free just to throw those in the chat box. I'll make sure to keep an eye on those. And we also have a few other 3RNet staff members here. So we'll make sure to get those questions answered. We are recording today's session, so we will share this recording as well after we wrap up the session today. So before I kind of jump in, we do have our Executive Director, Mike Shimmons, with us today. He's actually traveling, but was able to join us remotely via his hotel. So Mike, did you have any welcome for the group?
Yeah, I certainly did, Mark. Thank you very much, everybody, for joining us today. We're very excited to offer this opportunity to interact with Mark in the site and see how it works for employers and all the new and different things that are available through 3RNet. We are excited to have so many of you, as well as our network coordinators. I see several network coordinators are participating on the line as well. You're what make 3RNet work, and we certainly appreciate the support and the time you put into it. And we are definitely here to answer your questions. I know Mark will do a great job leading you through some of the most basic things of 3RNet, and then also some of the new features that we have and some new opportunities we have as well. So just thanks for coming. I hope you can join us. As Mark said, this will be a regular occurrence going forward. So we're looking forward to those interactions. And thanks for letting me speak for a few minutes here, Mark, and good luck on this one today. Thanks.
Awesome. Thank you, Mike. And we also have our Director of Communications and Marketing, Christine Morin, on the line. Christine just reminded me via the chat box that we are also giving out a Stanley tumbler at the end of today's session. So my daughter and wife told me those are very cool. So hopefully that's very exciting for you guys all. And again, thanks for joining us, and we'll go ahead and pick that winner towards the end of the session today. So I just have a few slides here, but we're going to spend most of our time kind of actively looking at the dashboard, the employer dashboard, and kind of answering your questions there. But just a little bit about 3RNet. If you're kind of maybe new to using 3RNet, or just a little bit unsure of how 3RNet is different from other, maybe job boards or candidate resources that you're using. So 3RNet, our kind of tagline here is, we are the nation's most trusted resource for health professionals seeking careers in rural and underserved communities. And we have been powered by the National Rural Recruitment and Retention Network since 1995. So we have been around almost going on 25 plus years here. We are a nonprofit. So again, there's a few things that will come across today, again, of what makes 3RNet a little bit different from some of the other resources that you might be using. So the way that 3RNet primarily works is we have one member organization in each state. So each of those member organizations, as Mike mentioned, we refer to as network coordinators, and we have a number of them on the call here with us today. But essentially what we do here at 3RNet at the national level, we have 5 staff members and a board of directors that govern us as a nonprofit. But we provide all of our services to that one network coordinator in each state. And then you as an employer are working with that network coordinator to access 3RNet on a day-to-day basis, to post your jobs, to get access to candidates, to learn educational resources and materials. So all of that is provided to you through your network coordinator. So if you don't know who your network coordinator is, that is certainly something that we'll want to make sure that we kind of provide you that information here at some point on this webinar. But each member organization is unique. So they're primarily state government type of organizations, nonprofits. Again, it just depends on how the model is set up within the state, but state offices of rural health, primary care associations, primary care organizations, all of these listings here as far as our member organizations are all in the arena of rural and underserved workforce. So all of the resources that you have, all of the things that you've traditionally been able to do are provided by those 3R network coordinators who do kind of the majority of our outreach to rural and underserved employers like yourself, but then also connecting you to mission-minded health professionals. So this is maybe the most kind of helpful graphic just in general of how 3RNet works. So we have job seekers that are coming to our website and registering with us, indicating that they're interested in looking for careers in rural and underserved areas. So you can see our job seeker over on the left, which was actually a physician that was placed by using 3RNet. And then over on the right, we have employers like yourself that are coming to 3RNet to post your opportunities and try to attract those job seekers. And then in the middle, we have that one primary network coordinator that's kind of facilitating those connections. So keep that in mind as we're walking through everything today. The majority of the resources, job posting, educational resources, and candidate referrals are going to be provided to you via your network coordinator. And then as Mike alluded to a little bit at the beginning of the call, we do have a new kind of service that has just launched this year called 3RNet Plus Tools. That is something that's offered directly through 3RNet as a subscription, and we'll spend a few minutes at the end of the call covering that today as well. So just a reminder for those of you that maybe have just joined us, the chat box is open. Please feel free to throw in any questions or comments as we're walking through the training here today in that chat box. So I'm going to close this PowerPoint out and then open up our dashboard. So hopefully this looks familiar to you. So you as an employer, so I'm already making the assumption that most of the employers on the line are registered and have 3RNet accounts. If you aren't registered with 3RNet or don't have an account, the first step is to apply. So that's just on 3rnet.org, register employer. You fill out this information to create your account, and you'll be notified via email when you are approved by your network coordinator. So again, I'm kind of already making the assumption that most of us have taken that step, but that is the first step if you haven't already. And then from there, where you will interact with the majority of your 3RNet resources is on the dashboard. So you can bookmark that link directly. So it's just dashboard.3rnet.org. I apologize for jumping around a little bit here on you guys as far as tabs, but I'll go ahead and throw that link in the chat box there. And so the majority of what you're going to be doing as an employer is accessing the dashboard to post your jobs and interact with the candidates that are referred to by your network coordinator. So before I log in here, I see we do have one question from Kendra. So hey, Kendra, does my network coordinator have access to people who are seeking employment all over the US or just in the state that they are the coordinator for? So that's a great question. Our network coordinators have full access to the entire candidate database, but only our network coordinators. So we have 54 network coordinators, one in each state. And then the Department of Veterans Affairs, Indian Health Service, the Northern Mariana Islands, and Cherokee Nation make up our 54 network coordinators. So each of those network coordinators do have entire access to our candidate database. So there are certain times, for example, maybe you're like me, I'm located in Grand Forks, North Dakota, which is right on the border of North Dakota and Minnesota. So occasionally maybe there'll be some candidates that are interested in working, in North Dakota that might have indicated Minnesota on their profile. So it's certainly okay to reach out to your network coordinator and ask them those questions and ask them to, potentially send you some referrals from, outside of just your state. Okay, so again, on our dashboard here, I'm going to go ahead and log in with my username and password. And if you don't know that, feel free to get a hold of me and I can help you with that. And then I am logged into the system. So the primary kind of three things, the three services that are provided by your network coordinator that we're going to spend most of our time talking about today are posting job opportunities, accessing candidate referrals, and then also our Recruitment for Retention Resource Center, which is a list of educational materials. So those are kind of the three things in order that we're going to be covering today. So once you log in, you'll automatically be directed to your summary dashboard, which will show you kind of a summary of those different things that you're working with. Showing you the most recent active opportunities that you have posted. And then in each of these grid views that you see in 3RNet, you're always able to act upon them under this actions button. So we'll get into more of these options later, but you can do things like post similar, you can edit your jobs, you can report placements, all of that right from your summary dashboard here. So if I wanted to add a new opportunity, I can do that in a couple different ways. So the first way to do that is just under the job opportunities drop down over here in the left-hand column, and then click add new opportunity. So when I click add new opportunity, basically there are kind of two segments to adding an opportunity in 3RNet. So the first thing that's going to happen is it's going to show you all of the required fields in the system. So when you click that add new opportunity button, all of these fields come up and all of these are required to post a job opportunity, but these are the only required fields. So once we fill out these required fields, we'll have kind of two different options. We can either click save and exit, which would then just post the job directly to 3RNet, and we could kind of move on. Or if we want to add more details about, say, compensation, community information, benefits, we can click save and add detail, and that will bring us to a future, another screen with more fields and more chances to kind of expand upon your opportunity. So just going through some of these example fields here. So let's just go ahead and post a position here. So I'm just going to make this very generic, just for the sake of time today. But one thing I will mention in this job title section, this isn't really a field that jumps out a lot to candidates and to health professionals. And we are going to spend some time looking at how health professionals see opportunities. So do spend some time looking at that job title and try to make it kind of flashy. Include some of the things that you make your community or your opportunity unique. You know, loan repayment offering, signing bonuses, you know, career advancement, any of those, you know, things that you think are really drawing candidates to your community. Make sure that you're including them in that job title. From there, profession. So this is pretty easy. So you just type in the name of the profession, or you can scroll through it. But if you type in the name, it will kind of auto-complete for you. So you can then just select the profession that you are trying to post for. And a few notes about the profession field. So 3RNet's not just for clinical professionals. There's over 300 different options, both clinical and non-clinical on 3RNet. And once you are approved to post, you can post any of those jobs that you're looking for. So again, anything from administration, leadership, nursing, ancillary, mental behavioral health, dental, of course, primary care, office administration, any of those folks that we all know are so crucial to maintaining, you know, adequate care in rural and underserved communities. You should have the ability to use 3RNet to post your jobs within that profession. Also, please note that this field is a multi-select field. So for example, if I'm hiring a dentist in this example, maybe I'm willing to consider either a general dentist or a pediatric dentist. So you can see I can select it as both. And then when I ultimately post this job, that job will be cross-posted both for general dentists and pediatric dentists. And this is really important for a few key reasons. So first of all, it saves you time because you don't have to, you know, post one job and then immediately go back in and kind of cross-post it. You can just do it all in one posting. But also everything as far as how you attract candidates in 3RNet is primarily based upon their profession. So when I post this job, a few things happen. First of all, of course, it goes to the public website so that you know, health professionals can actively search our website, find your job, and reach out to you. But also this job would get emailed out to all of the health professionals in our database that match the criteria listed. And that's primarily based upon profession and then the state of the job that you're posting it in. So right now, if I was to post this as a general dentist job in North Dakota, again, once I posted this you know, test opportunity would go to the website, but it would also be emailed to all of the general and pediatric dentists in the state of North Dakota that are in our database that have signed up for email alerts. So by cross-posting, you're getting your job emailed out there, you know, wider if you're including kind of those additional professions. And then lastly, most of you are probably familiar with and have received candidate referrals from 3RNet. And that's the next thing that we're going to look at after we talk about this job opportunity. So the candidate referrals that are made to you from your network coordinator, again, are primarily based upon profession. So if you only post this as dentist general, you're only going to get candidate referrals for general dentist, where if you post it as both, you'll increase the candidate pool of the referrals that you're getting from your network coordinator. And that's true for any profession. So if you're posting for primary care, you know, NPs, PAs, mental behavioral health. Make sure that you really kind of include any sort of professional that you're willing to consider, because that will definitely get you a lot more exposure on the website. Moving forward here, a few of our other required fields. So is this an employment opportunity or a training opportunity? You certainly can use 3RNet to promote training opportunities as well. So if you're looking for students to do a rotation, internship, anything like that, you can certainly use 3RNet to promote those as well. And those do display differently on the website for potential candidates. Obviously your state, city, zip code, county, those are all pretty self-explanatory. Primarily that location information is used for mapping. So on the public side of the website, there is kind of an interactive map that candidates can use to look at job opportunities. Job details is just kind of an open-ended text field. And this is probably, I would consider it the second most important field next to job title, because when health professionals are looking at your opportunity, they're first going to see that job title, and then it immediately goes down into those job details. And again, we are going to spend some time looking at how health professionals see your opportunity. So keep in mind when we get to that section, job title and job details. And then a few more required fields, and I'm going to circle around to some of the questions that we have in the chat box, but your HPSA score, so Health Professional Shortage Area Score, this is a federally designated score that essentially tells health professionals, how rural or underserved you are. And that score is important for a lot of health professionals because it determines your eligibility for different incentive programs like loan repayment. So if you're unsure of your HPSA score, you can either use this link to find it out or get a hold of your network coordinator, and they can certainly help you with that as well. Community type, community population, service population, employer type, employment type, and then finally these three kind of extra options down here. Are you willing to consider a J-1 visa waiver? So if you're not familiar with the J-1 visa waiver program, that is geared towards international medical graduates. So somebody that, attended med school in a foreign country and then came to the United States to do their residency. Typically that physician would have to go back to their home country for a period of a number of years before they could come back to the US. If you are in a rural or underserved area, you can sponsor what's called a J-1 visa and waive that requirement for a foreign physician to have to go back to their home country and basically allow them to stay in the US. So that is a very competitive program in a lot of states, but there are a lot of very, very good J-1 visa waiver candidates out there. It's extremely hard, as you likely know, to get into a US residency, especially if you have attended med school in a foreign country. So some of those J-1 visa waiver physicians are the top of the top physicians that we have to kind of offer. Loan repayment, of course, nobody can guarantee loan repayment typically, but if loan repayment is an option, or if you have a HPSA score that's usually competitive enough to provide loan repayment, you can select that. And then also telehealth opportunities. So again, those three are also important along with HPSA score, because those are searchable fields for candidates when they are searching on the public site for jobs. So let me pause there. I see another question here in the chat box from Laura. So you email out the jobs when we post them to your database. If the opening is open for a while, do you email them out again if we edit the job? Yes. So the way that the system is set up, and thank you, Laura, for mentioning that, the way that our system is set up is you post a job and it's active for 3 months at a time. And if you don't pull your job down within those 3 months, the system will automatically renew it. So the system will assume that you haven't filled it and automatically renew it and kind of push it to the top of the list. What happens in that instance is your job then shows up with an updated date. If you do not renew it, so if it auto renews, those emails don't go out. But if you do go in and edit the job and repost it, that does trigger those emails. So again, it's a little bit, there's a couple different ways to do it, but if you go in, to answer your question, if you go in and edit a job at any time and refresh it, change some information, and basically post it, that will trigger those emails to go out. Okay, so Kim is asking, would you be able to update that section where you can select fellow resident accepted? So Kim, I think, are you talking about the employment training opportunity, or maybe down here as far as an additional option for the job itself? Okay, downright. Okay. Thank you for that feedback, Kim. Let me add that to my list, and hopefully, as with any sort of web-based system, we're always making updates and improvements. So hopefully you guys have seen that if you've been using FreeRNet over the last number of years. But Kim, that sounds like a great idea. We'll certainly make a note of that. Okay, any other questions about posting a job at this point? Okay, so since I'm not actually going to go through and post this job because this is just a made up job, but again, the general premise would be you go through, you fill out the required fields. If you click save and exit, you would be done. If you click save and add detail, you will be brought to another screen with more information. And let me just show you what that looks like. So if you click save and add detail, you will be brought to a screen that looks like this. So the opportunity details, those are all of those required fields that we just looked at. I clicked save and add detail. I am now in an additional tabs, 3 tabs across the top here where I can enter information about my employer. So all sorts of information about your employer, including an application link. So if you want to drive that health professional directly to your application, you can certainly do that. Work schedule, contact information, social media information, website information. And then each of these 3 tabs has what we call unique selling points. So this is going to factor into some of the education that we're going to talk about later. So we talk a lot about what makes one rural community or what makes one underserved opportunity different from another one. So we like to talk about having organizations find what makes them unique in a positive way. So I used to be the North Dakota state coordinator here for FreeRNet, and I helped a number of hospitals recruit, and many of those hospitals would use kind of the same 3 selling points when they were talking to candidates. They would talk about loan repayment, they would talk about outdoor opportunities, and good salaries. And again, if you have 15 people all talking to the same pool of candidates, they're all promoting the kind of the same 3 things. You know, the effect of that is nobody is standing out. So what we try to kind of teach and educate on is finding your unique selling points. And again, I'm going to later reference and show you where you can find some educational resources to kind of self-identify those unique selling points. But those unique selling points that you identify yourself, you're able to tag those here on your job, and health professionals are also able to see those things as well. So employer details, community details, so information about your community, and then compensation and benefit details. Remember, if you choose to add any of this information, all of this is supplemental. So if you're not comfortable, for example, posting a salary range, you certainly don't have to. But if you click save and add detail on that initial job entry screen, you'll be prompted and you can fill out any of this information that you feel like will give you a better chance to attract health professionals. So let me scroll. I see a few more comments here. Okay, so Karen is mentioning, so one of our network coordinators, Karen there in North Carolina, is kind of piggybacking and on the earlier idea from Kim as far as accepting new graduates or fellows and residents. So I think that is helpful. Thanks for that, Karen. And then Carlos, we have 4 recruiters at our organization. Do we each need a separate login? So there's kind of 2 ways to approach that. So you can certainly all 4 share an account with a general username and password. Then all 4 of you would have access to the same jobs and the same candidate referrals. So if you all are kind of working together, I would recommend just having one central account and using that. But if you're kind of separated into different departments, let's say you have a nursing department, maybe a physician department, something like that, you can all have separate accounts. You can have as many accounts as you need on FreeRNet. So it's really just kind of up to how your organization is set up. But if you need help either updating your username or password, or creating more accounts, feel free just to shoot me an email and I can certainly help you with that as well. Okay. So, so that was kind of walking through the posting an opportunity. Let me just break down a few more things about opportunities, and then we'll go ahead and switch gears into looking at our candidate referrals. So you can always see all of your current opportunities under job opportunities over here in the left-hand column, all opportunities. From there, you can see a different piece of information as far as how many times a job has been viewed, when it was created, when it was last updated. Under that actions button, I ran through some of these quickly earlier, but post similar is maybe one that might get the most use. So let's say you post a job and then, a month later you go and you're going to post another job. Well, if you don't want to kind of copy all of the content, or if you don't want to start from scratch and have to manually kind of put in all of that content again, you can basically find one of your existing jobs in the system and then use this post similar feature. And if I click this post similar feature, essentially what that will do is it will bring me into a new job posting, but it will have all of the information pre-filled out for me based upon this job that I'm starting from. So you can still make any changes or change anything, maybe change the profession, specialty, whatever the case may be. But using that post similar feature will allow you to kind of quickly duplicate jobs without having to start from scratch each time. You can also edit your jobs at any time. You have full ability to edit your jobs at any period that they're active on 3RNet. You can share to social media. So if you want to share your 3RNet job link to your Facebook, LinkedIn, Twitter, anything like that, you can certainly do that right from here. You can view it on the website. So this will show you what it looks like to a candidate. So view on website will open up your opportunity as a health professional would see it, which we're also going to spend some time on today. You can report a placement. So as we are partially federally funded, it is really important for us to kind of be able to identify, numbers of placements and referrals and that sort of thing. So if you are successful, which hopefully some of you guys, all of you guys have had at least 1 or 2 success stories from 3RNet, you can report that placement. You don't have to include a lot of information about it, but it's helpful for you because you can keep track of those within the system, and it also helps us and our network coordinators kind of continue to justify the funding that we get to put on 3RNet. And then ultimately, if you're done with a job and maybe you filled it and you don't need it live anymore, you can also deactivate a job, which will pull it down. Okay, so let me pause there on job opportunities. Any other questions or comments about the process of posting an opportunity on 3RNet? Okay, hearing none, let's go ahead and move on. So I'm going to navigate back to our summary dashboard. And then, so we just covered kind of our opportunities section. So that was the first thing that I mentioned we were going to cover today. The second is our referrals section. So I'm logged in as just a test account here. So again, there's not a lot of referrals to look at, but hopefully you guys are familiar with this screen. Hopefully you've been actively reaching out to the candidates that you're working with. But the way that 3RNet works, again, as we talked about earlier, our network coordinators have access to our full candidate database, which has about 80,000 active candidates and hundreds of new candidates registering with us every month. All of the candidates on 3RNet choose to register themselves. So we're not necessarily, buying lists or kind of cold calling people, things like that. All of the health professionals that you're getting referred to on 3RNet have actually physically came to 3RNet, entered their own information, and created their own account. So when you're looking at this referrals tab, a lot of you probably are noticing that you see your referrals come in on Tuesday morning. And that's because there's a specific way that our network coordinators can make referrals that go out every Tuesday morning called automated referrals. But however you're getting your referrals, whether they're coming in every Tuesday or whether they're coming in throughout the week, or there's a few important things to know about interacting with these candidates. So first of all, you can see all of their contact information that we have here listed in the grid, including their CV. So if there's a dash there on the CV, that means that when that candidate created their 3RNet profile, they chose not to upload a CV. So you would have to reach out to them to request that CV. Also then, there's an expiration date for each health professional that's made to you by your network coordinator. So that expiration date is 7 days long. So when you get that email letting you know that you have new health professional referrals on 3RNet, you basically have 7 days to start your interaction with that health professional. And then that candidate will basically kind of disappear from your active referrals section. If you're set up for automated referrals, which many of you are, again, you'll notice that Tuesday morning, you'll have a new batch of referrals, and then those will go away. And next Tuesday, you'll have an additional list of candidates to be able to contact. A few other things from here, under the actions button, you can view that candidate. So you can see their full information. And one new feature that maybe you guys have noticed, maybe you have not, we have partnered with two national organizations dedicated to rural and underserved healthcare, just like we are. So the National AHEC organization, so that the AHECs, which stands for Area Health Education Center, exist in most states, and they are very heavily invested in helping health professionals through the training process. So hopefully some of you have worked with the AHECs in your state before. They do things like help set up rotations, help fund temporary housing for students, facilitate additional training opportunities. So we partnered with the National AHEC organization because they have a credential called AHEC Scholars. And there's about 300 AHEC scholars that go through a specific training process each year. So they are able to register on 3RNet and indicate they're an AHEC scholar, meaning they've went through that additional training process, and you're able to see that information. So you're able to see that somebody is an AHEC scholar, and the same thing with the credential to the right of that, which is a certified rural health clinic professional. That credential is given out to health professionals from the the National Association of Rural Health Clinics. So again, lots of acronyms in there, lots of word jumbles, but just in general know that if you see a candidate with one of those credentials, those candidates are uniquely qualified to work in rural and underserved areas. And then also by partnering with those national associations, who are also both nonprofits, they're actively promoting 3RNet to all of the clinicians and candidates they're working with. Okay, let me jump up. I see a couple other questions here. Okay, so Deborah, how do candidate referrals make their way to the recruiter? Is that connection made from your end? How does it? So Deborah, those referrals are set up by our network coordinator. So each network coordinator operates 3RNet a little bit differently in their state. So some of them might be making them to you manually. Some of them might be setting you up for automated referrals, which come every Tuesday. If your account is old, so we made a lot of changes to the website in late 2021. So it's possible that if your account is old, you might not be set up for referrals yet. So Deborah, if you just want to shoot me an email, and I can throw my contact information in the chat box here, but if you just want to get a hold of me offline, I can take a look at specifically at your accounts and see kind of what we're missing as far as those referrals. Okay, and then Stacy's question, as far as the question that was answered earlier, as far as Laura's question. So if your opening is open for a while, do you email them out again? So those emails are sent out when a job is posted or updated. So if you go into the system and update one of your opportunities, we process those emails again and send those out to the health professionals that are in our database. Okay. So again, opportunities, referrals, a few other points about referrals. You're only going to get referrals for job opportunities that you currently have active. So again, that's why it's really important to make sure that you're cross-posting your jobs, making sure that if you're looking for primary care and willing to consider internal medicine, pediatrics, family medicine, that you're posting your jobs as such. Because all of those referrals made to you have to match up to one of the opportunities that you have active. Also, one kind of little hint I would keep in mind is sometimes it's really convenient, or it seems easy to use that profession field called other, as maybe kind of a catch-all. That certainly can work, and it can get out there for you and get you some exposure, but we typically don't have any health professionals coming to the website and registering as other. So if you're posting your job as other, you may not see a whole lot of referrals. If we don't have a really good fit for the type of job that you're trying to post, again, just get a hold of me and I can make sure that we either add a new profession if it's something that we truly don't have, or I can point you in the direction of what we have that maybe matches closest to the language that you're looking for. Okay, another question. Is there a way to list more than one profession for a posting? Meaning if we would accept family medicine and or yes, yep. So remember, when you're posting an opportunity under job opportunities, add new opportunity. In the example that you just listed, you could start typing in that you're looking for a physician, family medicine. You could also take family medicine OB, internal medicine, pediatrics. So yes, so when you are posting a new opportunity, you're able to take as many professions that you're willing to consider as needed. And then all of those, once you ultimately post that job, all of those jobs will be cross-posted. So you'll reach the candidate audiences, both through email and referrals for each of those professions. Kim's question, does show for job postings? Yes, so if you tag it as 4 different professions, the system will treat it as essentially 4 different jobs. And if that is an issue, specifically in how you kind of operate or how your state operates, again, feel free to let me know and I can kind of help you troubleshoot that. But because of the way that health professionals search for jobs, they're typically searching for their profession or specialty. The system does kind of look at those as, you know, distinct jobs so that those emails go out and those referrals go out as well. Okay, any other questions here about the referral process? Okay, excellent. One just quick thing that I'll mention as we're looking here talking about referrals. We do an annual survey every year. You may or may not have seen this from your network coordinator, but you can always find our latest data at 3rnet.org/impact. Again, because we are a nonprofit, because we answer to our funders, we put together an annual survey each year that's reported data from our network coordinators, so you can go through. And just to highlight a few of the numbers that we were just looking at, so there were over 170, almost 170,000 referrals made last year through 3RNet. So those referrals are going out. Again, a lot of you are seeing them probably weekly, if not more often. And we're constantly trying to find new ways to, you know, reach those health professionals through career fairs, through education around loan repayment, different rural and underserved specific educational topics. So again, we're working really hard to get those candidates in the database so they can be referred to you as well. And you can see of those 169,000 plus referrals last year, our network coordinators, our 54 network coordinators reported just over 3,200 placements. Okay, another question here from Kendra. If you're not getting many referrals, is there something you need to do to change that? I need optometrists desperately. So the first thing that I would do would be to get a hold of your network coordinator in the state. They may be able to actively go into the database and send you some additional candidates that fall, you know, again, might not have expressed interest specifically in your state. For example, if I'm here in North Dakota and maybe there's a really tough search, myself as a network coordinator, if I were a network coordinator, instead of just making referrals for candidates interested in North Dakota, I could expand my search to say, show me candidates interested in North Dakota, Minnesota, you know, those sorts of things, South Dakota. Our network coordinator in Wyoming is Carrie. And Christine, if you mind, can you throw that link in the chat box again for our network coordinators? So there's a link that you can find on our public website that will list all of the network coordinators' contact information so you can reach out. And then also, Kendra, talk to your network coordinator, and certainly you can always get a hold of me and I can always look up your account and kind of figure out exactly how your account is configured to be set up for referrals as well. Okay, any other questions on referrals? Okay, just a few more things. We've got about 15, 20 minutes left here. We'll make sure that we end up on time, if not a little bit early. But a few other things that I wanted just to show here today. The Resource Center. So if you are kind of new to recruiting, or maybe it's just been a while, or maybe you're looking for specific, rural specific resources for recruiting in education. Our Resource Center, this is the test site, so it only has a few different resources here, but on the main site that you guys would always be seeing, there are a lot more options. So you'll see all sorts of information. We have recruiting guides that are broken up, like step-by-step guides as far as your recruitment process. And each of them have reference materials too. For example, if you're struggling with your recruitment team, there's an action plan in here that can kind of help you walk through creating that team and managing those duties. Another thing that I alluded to earlier was those unique selling points. So those are what we call factors books. So factors to market your community, find your unique selling points. So they're broken up into a couple different common facility types: community health centers, rural health clinics, and critical access hospitals. So for example, if you're a critical access hospital, you can download this guide. And what this guide is it goes through 50 research validated factors that were identified through a project called the APGAR project. And there's some information in that book about where those factors came from, how they were identified through research. But what this book does is it walks you through each of those 50 factors that are related to why candidates want to work in a rural or underserved area. And then it helps you identify what does this factor mean? Why is it important? What might it look like if my community or my facility has an advantage in this factor? What might it look like if my facility or community has a challenge in this factor? And then if you do identify something as a challenge, what are some ideas or solutions to that challenge? So again, by walking through these 50 factors, you can potentially find some things that maybe you're doing really well that you've never thought of promoting before. And then also identify any sort of potential barriers that you might have to kind of allocate resources to overcoming those. So that is our Resource Center. That is available to you. As soon as you create your account, you can access all of those resource materials free of charge and download them under our R4R Resource Center. Okay, so we covered opportunities, posting an opportunity. We talked about referrals. We looked at our Resource Center. Two other things I wanted to cover today. I had mentioned earlier, we're going to look at how a candidate sees an opportunity. So let me navigate over to our public site, which is just 3rnet.org. So here you can see the job search interface for a health professional. So they can open up, they can search by profession specialty, they can select the states that they're interested in, whether they're looking for a J1 job or not, loan repayment, telehealth, HPSA scores. Remember, all of those are those fields that we indicated earlier. And then also right on our homepage, you can see we have different opportunities displayed right here. So by keeping your job updated, it has a greater likelihood of showing up on the homepage. And then you can also see we have the ability to feature jobs as well, which I'll talk about just in a few minutes with 3RNet Plus tools. So if I were looking for family medicine physicians or nurse practitioner family medicine physicians, for example, I could click search. So there are two different ways a health professional sees your job opportunity on the site. So you can see when they run their search, all of their results show up over here in the left-hand column, and that bold. So this first one is nurse practitioner. So that is the job title of that job. The second one, advanced practice provider, full spectrum family medicine in Central Montana. That is the job title of that job. And then underneath that, the job details. So this text that kind of fades out, that's that open-ended text, that job details section that was also required. So again, keep in mind those two fields specifically, because you can see that when a health professional is not logged in or registered with 3RNet, they only see a very small amount of information about the job. They basically see your job title, where it's located, a little bit of the details, a little bit about the employer, and then the network coordinator in that state. So, so again, keep in mind, because what we're trying to do is attract their attention enough with the job title and some of these pieces of information that would allow them to register with us or log in with us, because all of those candidates that are being referred to you again have registered and are continuing to log in with us. So basically, we're trying to show health professionals some information, get them excited enough about an opportunity so that they're willing to register with us. And then once they register with us, that's how those referrals are then processed over to you. So let me sign in here, and then I see we have another question. I will go ahead and answer that. But so this is what a health professional sees when they're not registered. So if I was to log in right now as a health professional, you can see I then see the full information about the job. So there are two distinct ways a health professional sees the opportunity. They see just the basic information when they're not logged in, with a focus on the job title and the job details. And then if they're interested enough to either register with us or log in to see the full information, then they see all information included, including any sort of application link that you would have posted. They see your social media connections. They see the full information about your organization, including kind of where it is geographically, and then your contact information as well. So by posting the best kind of job posting that you can, including those unique selling points, really trying to grab candidates' attention. Hopefully that is going to lead to more candidate referrals, more candidates acting upon your job posting and reaching out to you proactively to learn more about coming to work with you. Okay, another question here. So how can you search for a past candidate that applied so you can go back and read his or her profile? So remember, when a candidate is sent to you, when a candidate's referred to you, you will have 7 days to act upon that candidate. If for some reason you miss that 7-day window, and that happens from time to time, maybe you're on vacation or whatever the case may be, maybe it slips your mind, feel free just to send me an email. I can, from my end, always run a historical report of all of the referrals that have been made to you and send you that one that you may have missed as well. So again, you have 7 days to look at a health professional when it is referred to you. If you happen to miss that 7-day window, get a hold of me and I can try to help out as best I can. Is there a way for us to see what our postings look like to a provider? Yes. So remember, when you're logged in on the dashboard, under that actions button, if you are under job opportunities and all opportunities, so job opportunities, all opportunities, under that actions button, there is an option to view your job on the website. So that if I click on that, that will open up a new tab showing your job again on the production site or on the public site. So again, if you want to look and see specifically how your jobs, so to see the full job details, you can also, with your employer account, log in on the public site. So yep, you don't have to register. So you would just use the same login that you do on the dashboard. So you could log in as an employer and then you would see the full details about your job there as well. So again, the same username and password that you use on the dashboard can also be used on the public site to view exactly what your job looks like. Yep. Debbie, so you can reach me either at barkley@3rnet.org or Christine earlier put in, oh, sorry, I keep sending Christine messages, not everybody. So you can reach me directly at barkley@3rnet.org or info@3rnet.org. I monitor both those email addresses and take care of both of those. So anything that you guys need, feel free just to get a hold of me. I've probably talked with many of you before, but always happy to jump on a call with you or help you via email with any questions or accounts, things that you would need. Okay, so let's just do a quick recap here. So you as an employer get most of the resources that we just talked about from your network coordinator, that one primary member that we have in each state. That network coordinator is the person that allows you to post your job opportunities that you can post for in any profession or specialty. Those job postings go to our public website. They also trigger emails to our candidate database. And also then your job opportunities are what will indicate what referrals that you get. So the referral section was kind of the second section that we talked about. So you're able to follow up with these health professionals directly. Again, us here at 3RNet, we do not charge any fees for you to use 3RNet. Any fees as far as job postings or anything like that would come directly from your network coordinator. So again, make sure if you're not sure if your network coordinator charges fees or not, you probably would have heard it from them, obviously, before you created your 3RNet account. But again, some of our members do charge a small fee, but typically those members provide some additional services as well. But you can post your opportunities, you can follow up these candidate referrals, and then also you can access our resource center for educational topics as well. Okay, so Deborah is asking, can you touch quickly on using 3RNet to source for candidates? So the way that you would get candidates from 3RNet is through those referrals. So again, you do not, as an employer, you do not have the ability to go in and search through our candidate database. So you kind of have two options. You can reach out to your network coordinator and kind of work with them. Again, many of your network coordinators probably already have you set up to receive referrals. So the way that you source candidates from 3RNet is on this referrals tab, and you can work with these candidates that have all been sent to you from your network coordinator via our database. So again, you as an employer can't access our entire database. You just have access to the referrals that have been sent to you by your network coordinator. And I talked a little bit earlier about some best practices for making sure that you get the most referrals. The most important thing to do is just make sure that you have all of your jobs posted. Okay, in our last few minutes here, as you guys are thinking about some additional questions, we've had some interest and some questions offline about 3RNet Plus tools. So 3RNet Plus tools is an additional subscription service. So all of the stuff that I just talked to you about those are all resources that are provided to you through your network coordinator. If you kind of want to expand your use of 3RNet, there is 3RNet Plus tools available. So 3RNet Plus tools basically gives you the ability to work with all of those resources that we just talked about in kind of an enhanced way. So one of the things that people really like with 3RNet Plus tools, for example, is under the referrals tab. I mentioned that referrals typically expire after 7 days. If you are a 3RNet Plus tools subscriber, you have access to a tracking system, which is called My Professionals. And you can take those referrals that have been sent to you by your network coordinator and actually save them into My Professionals. And then once you save them into My Professionals, obviously they're available for you beyond that 7-day period. So again, we don't have a whole lot of time to cover 3RNet Plus tools today. We can spend some more time on that when we do another training next month. But just know that with 3RNet Plus tools, again, you can save your referrals into My Professionals, which is a tracking system. You can also use this My Professionals tracking system for candidates outside of 3RNet. And within the tracking system then itself, you can do all of the things that you kind of would typically do with a candidate tracking system, or you can track your history with a certain candidate. You can see how they've been referred to you. You can upload files related to that health professional, set up reminders, what we call ticklers. And then also you can email opportunities right from here as well. So again, we don't have a whole lot of time today. We want to make sure that we get to our giveaway too, but just know with 3RNet Plus tools, there are many different things that you can do. Christine just put a link in the chat box. There's a short video on there. There's some different educational resources. It's a completely optional thing. But again, when you see some of those featured opportunities, for example, that I showed earlier, if you see something in 3RNet that you're not quite sure how to access or where that came from, it's possible that it's a feature that's available only under 3RNet Plus tools, which is $79 a month or $750 for the year. And everybody does get a free 30-day trial. So if you want to try it out for 30 days, you can certainly do that. Again, everybody gets a free 30-day trial. Okay, so that was a lot that we covered here today, and I apologize that we didn't leave enough time at the end to get more in depth into 3RNet Plus tools for you Plus tools subscribers out there. But know that you can always email me, and we can set up an individual time to go over 3RNet Plus tools as well, or any of the other things that we talked about today. But just in our last 5 minutes here, any questions or comments of kind of what we've went through? Okay. Yes, and as Christine mentioned, there's a lot of cool stuff. One thing I'll show you just because I think it's neat, and So if you're using 3RNet Plus tools, you can use your jobs from 3RNet to power your own website. So again, if you struggle to maintain your jobs on your own website, just know if you're using 3RNet Plus tools, there's an easy copy and paste way that basically any job or anytime you add a job or edit a job on 3RNet, it just automatically appears on your own website. And then when candidates interact with the job on your own website, they're fed right into your tracking system. So again, there's a lot of cool features in there that unfortunately we don't have time to talk about today. But check out that link that Christine sent, or feel free to get a hold of me offline, and I can certainly help you with that as well. Okay, so as you guys are thinking about any last minute comments or questions, I'm gonna go ahead and pick our winner here. So just random. Okay, so Taylor Betts. Taylor, are you still on the line? Okay, well, we'll assume Taylor is still on the line, and we'll get their contact information and send them out that Stanley tumbler that will come directly from Christine. So that will be exciting. Yeah, congratulations, Taylor. Any other comments or questions for the sake of today? Okay, well, hearing none, thank you again to everybody that signed or that joined us today. Again, most importantly, please know that you don't have to wait for these monthly trainings. This is the first one we've ever done, but we're going to continue to do them each month. But please don't wait if you have questions. Just get a hold of any of us at any time, and we're happy to answer questions and make 3RNet as beneficial for you as possible. So thank you guys so much for joining us today, and we will send out the recording probably tomorrow morning. Thanks, everybody.